When you're walking and you're in pain, there's nothing like it. It's like a grinding pain.
This is a similar theme that I see in people with severe arthritis. She had progressively worsening pain in her knee. This steadily limited her activity to the point that she could walk only about 2 blocks. She had difficulty with bending, difficulty with stairs, and difficulty sleeping.
There's nothing to ease that pain. I took medication, I was on anti-inflammatories, I did whatever I could, but it just didn't stop.
Knee replacement surgery is becoming increasingly common, especially as people are getting more active and staying more active throughout their adult lives and as we're living longer. Right now we're doing about close to 300 knee replacements a year.
I'm an active person, I work full-time, I run 2 medical offices, and I need to be able to go when I need to go.
Basically, what it comes down to is that when your knee is hurting and your quality of life is impacted, you want to get back to those activities. It used to be that we would shy away from doing people at 50 years old or 55 years old, but you'd rather have those 15 years from 55 to 70 with a good quality of life where you can still work and function as opposed to having to steadily decrease your quality of life.
I was teaching spin classes about 3 days a week, so that's about three plus hours, and then there's the training to do it.
Norma was very high functioning prior to surgery and was limited only by her knee arthritis. So I fully expected her to get back to that level of function after the surgery. When a person comes in with knee arthritis, I don't tell them that they need a knee replacement. My job is to educate them on what the condition is, how it can affect their day-to-day life, and what the treatment options are.
He asked me, what do you expect your outcome to be? How can I help you to get there? And I left there thinking no one else could do that surgery.
Welcome to our joint replacement class.
Before people undergo joint replacement surgery here at Memorial, we have a joint education class. That's a great way to help reduce anxiety about the upcoming surgery and facilitate the recovery in that fashion.
The education gave you an idea of what was coming, and there were people there that were having hip replacements and knee replacements, so we were all joined together and we were all having it done around the same time.
For patients that can't make the group therapy sessions, patients can also make an appointment with me, and we do that one-on-one with them. My goal for our patients when I speak to them one-on-one in a class is to get them in, to get them out, and to get them moving.
I was literally out of bed like 4 or 5 hours after my surgery, walking down the hall. I was like, I just had a total knee replacement and I'm walking.
Most people will wake up from surgery and the arthritis pain that they've been living with for years often is completely gone. They have surgical pain, which they can identify as different than the arthritis pain, but that surgical pain fades over a couple of weeks afterwards.
When you consider I had surgery in November and I was back teaching spin classes in February, that is amazing.
Knee replacement surgery has been one of the most amazing and effective advances in orthopedic surgery over the past 40 years. And it has changed dramatically during that time frame. It's amazing to see a person essentially limping into the office with pain that affects all of their daily activities. And then after a knee replacement surgery, see them walking without any pain, without a cane, without a walker, and back to all of their normal daily activities.
I can use the stairs. I can climb up on a ladder and not feel like my knee will go out.
The biggest transformation really is the absence of pain. Once the pain is gone, you're able to get back to the activities that you want to do, the things that you've been avoiding doing because of the pain for years.
I was living with that pain, and I thought that that pain would have to be a part of my life. I really live from a place of gratitude. I am so glad that I did this surgery.
I guess the question is, what are you waiting for? If you're having pain and it's infecting your quality of life, the time to do something is sooner rather than later.